Hi, my name is MarkAlain Dery. I'm an infectious diseases physician here at Access Health, Louisiana.
Your first question is, if monkeypox can be transmitted by touch, how should people be cleaning surfaces?
So that's a really good question. So while monkeypox is transmitted through touch, and we do know that monkeypox does live on surfaces for a long time, what we haven't seen with this 2022 outbreak is that surfaces where there is a virus where virus that lives on surfaces has been successfully transmitted to people. So viruses do live on surfaces. Certainly monkeypox does. We know that monkeypox is part of the orthopox or the pox family, and we know that other viruses like smallpox or what have you can live in blankets or what have you for long periods of time. Certainly monkeypox can't, but what we haven't seen is that there has been transmission from a surface to a human being. I would still continue at this point, just continuing to clean your surfaces as you would ordinarily do. Now, if there's somebody in your house who does have monkeypox, I think that it would warrant a more strenuous or more stringent cleaning if you are caring for somebody who has monkeypox in the house. And if that's the case, just call me directly and I'll be able to help walk you through that process.
How can I help protect myself against monkeypox?
So right now, what we're seeing in terms of social networks is that people who are getting monkeypox are mostly, not exclusively, but are mostly men who have sex with men. So if you fall into that category as a man who has sex with men, right now recommendations are to avoid any new partners rather, avoid intimacy with anybody with a rash, or who may have just recently been exposed to somebody with monkeypox. Now, what we have seen is that there are social networks, specifically the heterosexual social networks, in which we're starting to see monkeypox circulate. At this point, I would say the best way to protect yourself is to either decrease in the likelihood of engaging in intimacy with any new partners at this time until we can get folks vaccinated. Now, who's eligible for vaccination? So right now, the people who are eligible for vaccination are men who have sex with men, men who have sex with men who are sex workers, and men who have sex with men who have had a previous exposure. Now, to monkeypox. Now they are starting to vaccinate healthcare workers. There is movement in which healthcare workers should be vaccinated. I agree, especially healthcare workers that are evaluating and working with monkeypox. However, let's be clear that if you are a healthcare worker and you are wearing PPE, gloves, gowns, some sort of face mask as you are evaluating somebody with monkeypox, or you are doing labs, so you're doing the swabs for monkeypox, that PPE is enough that it protects you. We have not seen any cases of transmission from a patient to a healthcare worker. The cases that we have seen, there was one big one in Israel and there were several in Europe. The epidemiologists were not able to determine what that source of monkeypox was, because these individuals were also individuals that also are in the social networks that put people at risk for the first place. So it was difficult to determine whether it was an evaluation as a healthcare worker, as a physician, to somebody with monkeypox, or was it somebody in their personal time engaging in other behaviors that put people at risk in the first place. So as of right now, we've seen thousands and thousands of cases of monkeypox in the US. That means thousands and thousands of healthcare workers who've been exposed, and we have not seen any uptick in cases in healthcare workers. So please be gloved. Please, if you can, wear PPE and mask and gloves, certainly. Now, the other thing too, transmission not only occurs by touch, but it can occur through respiratory droplets. Those are the big droplets that are affected by gravity. So when it leaves your mouth, they fall to the ground pretty quickly, as opposed to something like COVID, which is transmitted, or measles, which is transmitted through respiratory aerosols. So those are tiny, tiny, tiny little particles in which the virus is able to kind of basically cruise through the air, and that's obviously how we saw COVID be so effective. Now, going back to monkeypox, because these are respiratory droplets, and because these droplets are affected by gravity and they fall down so quickly, it's very hard to get transmission from person to person through respiratory droplets, the CDC recommends that anything more than 3 hours puts you at risk. So for example, with my evaluation of people with monkeypox, usually they take anywhere between 20 to 30 minutes. I am masked. Of course, the patient is masked. We do not expose the lesions until it's time to actually do the testing. So I feel very comfortable being masked, knowing that the lesions are covered and they're only exposed for 30 seconds to a minute at a time when I'm actually doing the labs. So respiratory droplets can transmit virus, but again, that's in the setting if you're like spending 3 hours with somebody. So usually you see that in an intimate setting, somebody you may share a bed with, somebody that you may be physically intimate with, in which you have exposure to these lesions that could become transmitted through these sort of respiratory droplets.
Is monkeypox sexually transmitted?
So that's a great question. Is monkeypox sexually transmitted? That has not been firmly determined, although and rarely do infectious disease doctors disagree on things. We all tend to, look at something and say, this is a blue mask. Other physicians, they may call this a green-orange, who knows? But as ID doctors, and yes, I'm horribly biased, ID doctors, we tend to be we see things the same way. There's a very interesting rift in the infectious disease world as to whether or not to call this a sexually transmitted infection. I don't. Syphilis, herpes, HIV, chlamydia, gonorrhea, those are organisms that are transmitted through the physical act of intimacy, of sex. Whereas with monkeypox, there is transmission that occurs during intimacy because there's skin-to-skin contact, but not as a result of the act of intimacy, namely penetration or oral intercourse. That's not how transmission occurs with this particular virus. It's skin-to-skin contact. Now again, we see skin-to-skin contact in the process of engaging in physical intimacy, but not the sort of penetrative behavior in physical intimacy. Now, here's a big caveat. In there was a New England Journal article that came out last week that was an update of one that happened 3 weeks prior to that. What they found in both articles is that a majority of the men that they were investigating, researching, following for their monkeypox, a majority of these men had monkeypox DNA in their semen. Now, okay, great, there's monkeypox DNA in the semen. We don't know what that represents. Does that represent live virus, live reproducing virus? Or these particles of virus that are dead? We don't know. What they have not found was live replicating virus in semen. Now, even if we did, and let's say there's transmission from the host to the partner, does that mean that once the virus gets inside the partner, in an area of the body that's not used to seeing that virus, I would imagine that the mucosal membranes would block that virus from penetrating through to cause the disease process. I would imagine that if there was a true sexual transmission, that we would have seen more cases. All the cases that we've seen now are mostly described by touch. So, long answer, simple question, a nuanced and long answer. Do I believe it's an STI? No, I do not believe it's an STI. Can it be transmitted by engaging in sexual intercourse and other such activities? 100%, because the virus is transmitted from skin-to-skin contact.
Can anyone contract monkeypox?
Anybody can contract monkeypox. People who are more likely to contract monkeypox are people with immunosuppressive illnesses, and the studies that we've seen, almost 50%, almost 50, so it's really closer to, it's really 40%, but almost 50%. So 4 in 10 people, let me just say to be accurate, 4 in 10 people who have been studied for monkeypox had HIV. So it looks as though HIV probably increases the likelihood of transmission. I would imagine that people who are not taking medications, aren't virally suppressed for HIV, are more at risk. That's still yet to come, but as of now, it seems as though that most likely immunosuppressed people are more likely to be at risk for monkeypox.
Right. Where in Louisiana can I access monkeypox vaccinations?
So monkeypox vaccinations, if you go to the New Orleans Health Department, NOHD, just type in NOHD or New Orleans Health Department, monkeypox vaccines. You'll see a long PDF, and on that PDF will show all the places in region, I think we're in region 1, we're in region 1. In region 1, there's 8 or 9 regions that the state is broken up into in terms of the health department, the Louisiana State Health Department. And in region 1, the New Orleans Health Department has listed all the various places, including the bars that are having these big bar events as we're getting ready for Decadence. That's going to be happening this weekend. The feds have sent a tremendous amount of vaccines to New Orleans, which is of course having Decadence, to Atlanta this weekend, which is having a large Black Pride event, and then I think Colorado as well, which is also having a large Pride event as well. So these are areas where there could potentially be super spreading events, and so we need to get everybody vaccinated and protected as much as possible. I know that in my patient population and the social networks that my patients belong in, mostly the MSM men who have sex with men, that they have all been vaccinated. All my patients have been texting me telling me that they've been successfully vaccinated and they feel safe going to Decadence this weekend.
Can monkeypox be transmitted to pets in my home?
Monkeypox can be transmitted to pets. And in fact, we will see this virus potentially explode in small mammal populations, potentially. Now, we know that monkeypox originally was first identified, I think, in 1958 in a research colony of monkeys, hence the name monkeypox, but they are not the original host or the reservoir of the virus. We don't know what the actual host or reservoir is of the virus. We know that it probably belongs to a small mammal and a small mammal in Africa. Now, when viruses live symbiotically with a host, the host loses the symptoms of the virus that the virus shows. So how do we know that monkeys had monkeypox? Well, they had the lesions, right? So that tells you that they are not the original host. And the reasons why it's hard to find the host is, how do you find a negative in millions of small potential mammals that are frequent in East and West Africa? So the point is, though, is that could it get into a rodent population here in the US? Could it get into like a squirrel population? Could it get to pets? Yes, the answer is yes to all that. And if the virus is, and because this is, remember, it's a zoonotic virus, in other words, it does live successfully amongst mammals, and it doesn't kill its host. So without it killing its host, it can transmit virus to other mammals. And then, of course, there's no vaccines for mammals. And so you could see that there could potentially be an issue. As of right now, there certainly has it. We do know, I think, of one pet that I think did get monkeypox. And so if you do have monkeypox and you do have pets at home, please call me and I'd be happy to work with you directly so that we can figure out a plan to keep your pets safe and how you can keep yourself safe. But there can be transmission to pets, 100%.
Can I contract monkeypox by bumping up against someone in the grocery store?
That would be unlikely. It's usually more long-standing, continued touch or interaction with somebody. Again, the sort of thing that you may find when you're engaging in intimacy or maybe sharing a bed with an individual. So it's unlikely if you bump up against somebody that may happen, but certainly I would try to avoid, touching anything or anybody that you don't necessarily know. Certainly anybody who has a rash or any symptoms of monkeypox, of course, I would avoid.
Can people without monkeypox symptoms still transmit the virus?
No, transmission occurs when we saw COVID. The issue with COVID was that you could be asymptomatic, not know that you had COVID, and transmit virus. With monkeypox, that's not the case at all. To transmit the virus, you have to have the lesions on you, because it's the lesions that are potentially, the lesions that are infectious. So you are only infectious when you see a lesion, and that's it. When the lesions go away, you stop being infectious.
How can I treat monkeypox?
The only treatment for monkeypox is either post-exposure prophylaxis, PEP, so in other words, getting vaccine after you've been exposed, or if you have it, you can take a medicine called tecovirimat, which is an experimental medication that's right now under investigational approval. So it's called an EUA, emergency use approval, that we are using to treat monkeypox. It was a medication that was originally developed to treat pox viruses, and right now, because we're seeing this outbreak of monkeypox, it is now being diverted to see if there is treatment success with this medication for people who have monkeypox.
Do you have any other questions you want to address? Awesome.
Cool.